There you go, the recording started. And you are most welcome to share your questions and your comments in the separate chat channel. You can also use the raise hand button, and there will be time carved out in between the several sessions for questions and answers. We are really happy to say that we will have simultaneous translation. We have Maxim Rakovic amongst us, and you are welcome to choose the language if you want by pressing on the globe below the screen, choosing English or Ukrainian. And it will be most helpful if people don't talk too fast, so that will help with the interpretation. Yeah, and as said before, everyone will be promoted to panelists in order to enhance the communication and make sure that people can use the camera and the microphones. And well, before we will move to our panelists, we have 3 panelists. I would like to introduce you now to my colleague, Megan Bahmad. And Megan is a senior advisor for mental health and psychosocial support at ARQ International. And she previously worked in the peace-building sector, including for the international organization Search for Common Ground. And Megan will provide us an introduction by setting the stage on mental health and psychosocial support and social reconstruction. So may I invite you, Megan. Thank you.
Thank you, Relinde, and thank you to everyone again for joining our intervention webinar today. It's really, really nice to see so many familiar faces as well as so many new faces. I'm just going to kick us all off by briefly reflecting on this space of integrating mental health and psychosocial support initiatives on the one hand, and social reconstruction or peace building initiatives on the other. And just a quick note on semantics that for the purposes of this conversation on Ukraine specifically, we chose to think about the integration of MHPSS and social reconstruction rather than peace building. And this was a conscious choice, as peace building is a much broader term that often implies much more in terms of a higher level settlement or reconciliation process. And I think there's a general sentiment among Ukrainians and among those of us working in Ukraine that unfortunately we're not at that point where we can talk about peace building yet, but we can already begin to think about social reconstruction processes and the role that MHPSS can play in strengthening these processes, and how social reconstruction can also contribute to the psychosocial recovery of Ukrainian communities. So social reconstruction is also a broad term, but it really refers more specifically to processes that are taking place within a society itself to promote tolerance and peaceful coexistence. And this means fostering social cohesion within an affected community, giving community members the tools to address conflict non-violently and deal with past abuses, and ensuring that their formal and informal institutions that were possibly destroyed in the war are rebuilt in an equitable and peace-promoting way. Social reconstruction entails not only the physical reconstruction of a community, although certainly it's relevant to think about rebuilding infrastructure and rebuilding institutions in a way that promotes stability and well-being, but also the reconstruction of less tangible things like social relationships, norms, and even identities. On the other hand, we also know that violent conflict has a profound effect on the mental health and psychosocial well-being of individuals and communities. While not everyone who experiences conflict is traumatized or will have PTSD, we do know that the rates of common mental health disorders such as depression and anxiety increase in conflict-affected settings. And at the same time, psychosocial distress coming from daily stressors and changes to social support systems is also very common in the aftermath of war. So there is a need also to increase mental health and psychosocial interventions to support individuals and recover from the psychological effects of war. So what is the value of integrating these two fields, social reconstruction and MHPSS? Well, they're mutually reinforcing. The outcomes of both mutually reinforce each other. On the one hand, by increasing mental health and psychosocial well-being, we increase people's ability to function and go about their daily lives. And we also increase their ability to form supportive relationships. Together, these two improvements can also support individuals who are affected by war to seek social support, participate in community processes, and ultimately contribute to social reconstruction processes that are happening in their community. On the other hand, building communities that support each other and strengthening institutions that support communities also creates an enabling environment for people's mental health and psychosocial well-being to flourish. So we see that mental health and psychosocial well-being, MHPSS on the one hand and social reconstruction on the other, are really reinforcing each other. And the international community, ARQ included, has been working on this topic for quite some years now, this topic of integration. And there have been many recent developments within the past year or so in guidance on integrated approaches, which is quite exciting. There have been several high-level conferences at the governmental and intergovernmental level. Last year, there was a publication of a UNDP guidance note on the integration of MHPSS and peace building. Peace-building organizations such as Interpeace and International Alert have published reports on this topic. ARQ will publish a policy brief this week, actually, on this topic, including an in-depth case study on opportunities for integration of MHPSS and social reconstruction in Ukraine specifically. So we're looking forward to having that come out. And there's also a forthcoming report and policy brief from the Interagency Standing Committee Working Group on MHPSS and peace building that will be coming out before the end of the year. So lots of exciting reflections and guidance on this topic. And as we look toward the recovery and social reconstruction of Ukraine, I think it's really relevant to consider these different guidelines and how they can be applied in practice to strengthen both MHPSS and social reconstruction outcomes. So on that note, I'm very much looking forward to hearing from our panelists today on what they have to say on this topic. And with that, I turn it back over to Relinde and the panelists. Thank you again, everyone, for joining us.
Yes, thank you so much, Megan, for this introduction and for setting the stage of this very interesting topic we will discuss further today. Thanks so much. And before we move on to our panelists, I would like to give the word to my colleague David Nieuwenwemer, who will say something about some recent publications in intervention.
Thank you very much, Relinde, and thank you very much, Megan, for your inspiring introduction on this topic. And I just want to take a few minutes to look at intervention, Journal of Mental Health and Psychosocial Support in conflict-affected settings, to give you some background about the webinar. My name is David. I'm editorial assistant at Intervention, and today standing in for Rina Furkan, our editor-in-chief, who could not be here due to her travels and parental leave. Yeah, welcome again to this webinar on MHPSS and social reconstruction or peace building, two terms that are used, which we will also discuss on why we choose for this specific terms and not the other one. As always, the intervention webinars draw on publications from the latest issue, the one in October 2023 this time. And I wanted to give you a brief overview of the other publications that have been that you can see in this issue. There's a broad geographical spread in our latest issue, just as during this webinar. And we have publications from Czechia, Ukraine, to Syria, as well as Nepal. And even publications from Malawi, Colombia, and Greece. Then topic-wise, we have some articles which discuss the recurring issues such as PTSD, the prevention, as well as the treatment of that, as well as problem management plus the intervention. Also, we have some interesting submissions which have quite unique angle. For example, the article called "The Use of Comics to Promote a Community-Based Peer Support Intervention Among Youth Refugees in a Camp in Greece." We always very much encourage these kind of submissions because we want to be open to all kinds of angles when it comes to MHPSS and related sectors. So for this webinar, we have invited 3 authors from this latest issue, and they will speak more about, of course, their own publications. We've invited this panel specifically because we feel that there's momentum towards integrating MHPSS and peace building or social reconstruction going on at the moment, and we want to contribute to that as intervention. We hope to take a step towards furthering this integration of these both sectors. And I sincerely hope you will very much enjoy this webinar, and I really want to thank all facilitators as well as panelists for dedicating their time to this webinar. Thanks very much, and back over to you, Relinde.
Yes, thank you so much, David, for this overview of the latest issue of Intervention. Now I'm very happy to continue to introduce our 3 panelists of today. And as David already mentioned, they published such interesting articles in the latest issue of Intervention. I will start with welcoming Dr. Boris Budosan. Good to see you, Boris. So Boris is a medical doctor and specialist in psychiatry and public health. He has more than 30 years of working experience as a medical doctor and humanitarian worker in the Balkans, Western Europe, Southeast Asia, Africa, the Middle East, Caribbean and Western Pacific, and more than 15 years of experience in international health. He works with emphasis on community-based mental health care and community-based healthcare. So welcome, Boris. Glad to have you with us. And Boris published the article in Intervention Challenges and Opportunities for Mental Health and Psychosocial Support Programming during Ukraine refugee crisis in Czechia.
Yeah,
So
thank you. Oh, okay,
yeah.
You wanted to say something, right? Yeah, okay. I mean, I've been working actually supporting Czechia or Czech Republic. I mean, some people don't know that Czechia is Czech Republic actually in Europe, which has over 350,000 Ukrainian refugees. At some point, it was like 400,000, but some of them are coming and going, you know, like to Western Europe or going back to Ukraine. And I've been doing this for 1.5 years now. Mm-hmm. And actually, since it's about integration of how to say refugees and social cohesion, I would say, you know, in refugee receiving countries, I would like to say that, I mean, we are not talking only about Czechia. I mean, article is about Czechia focused, but I mentioned in discussion part also the other refugee receiving countries like, okay, I will have to name them all now. Poland, Bulgaria, Moldova, Romania, Hungary. I think that's about it. I hope I didn't Slovakia. Sorry, forgot about Slovakia. Yeah. So yeah, we have our regular meetings every 2 weeks, and it's been going like this for 1.5 years now, under the actually supervision of the WHO Europe, because now I'm actually working for the WHO Czechia, but under WHO Europe. This is the how to say, all these countries are under WHO Europe. So what to say, you know, I mean, for the next year, I would say, you know, that this is crucial, you know, this integration of Ukrainian refugees into Czech society, because Czechia has provided them a lot in terms of social determinants of mental health, which means mandatory health, you know, education, even livelihood, you know, then shelter. Still, I mean, there are some of them in collective accommodations, but most of them use also private accommodation, and and there are lots of projects going on. MHPSS project. It's not only WHO supported. but it's UNICEF there, it's IOM there, it's UNHCR there. They actually work through national partners. And the focus of the WHO is community-based mental health care. That's why WHO is supporting community mental health centers, so-called CDZ, in 7 regions of Czech Republic, and where there is actually a bulk of Ukrainian refugees. So, yeah.
Thank you so much, Boris, for this introduction and for describing the setting in which you're working. And we look much forward to hear you more when we go to the panel discussion. Thank you very much and welcome. I would like to move now to Professor Yvonne Sliep. Welcome, Yvonne, in this webinar. Happy to have you on our panel. So Yvonne is affiliated to the University of KwaZulu-Natal in South Africa. She's a critical community specialist in mental health and psychosocial support and works as an independent consultant. Yvonne, her work mainly focuses on strengthening social fabric in humanitarian settings, particularly with populations affected by conflict and displacement. Yvonne has worked in more than 20 countries. And Yvonne, perhaps you would like to add some words to this introduction in your own words?
Yes, absolutely. I would like to introduce my team members on this, because the integration work that has been happening has happened in a team with Marianne Tanning, who can't actually speak because her microphone button isn't working, so we can't see or hear her, but she can see and hear us. A medical anthropologist who has been an integral part of the development of this work, and Frederica Bubenza, who is a peace builder and has also really spearheaded this work. And Frederica, maybe you are able to see or respond and just show yourself as well. If not, I'll continue. So yes, the work that we wrote about in the intervention journal is about integrating, and at the time we called it MHPSS and peace building, and was based on a number of pilot countries where we've done this work in Africa, Kenya, South Africa, Northern Uganda, Zimbabwe, and more recently in other places where these programs are unfolding. I myself was involved in one in Iraq with the returning of the ISIS families and reintegration into community settings. So we've basically looked at this work from an organizational lens, but also in strengthening communities, recognizing, hi, Marianne, we can see you. Yes, also on a community level, but we working through the organization or from an organizational perspective, and really understanding that people on the ground don't experience these interventions in separate boxes in their life. They don't think, now I'm dealing with mental health, now I'm dealing with social reconstruction or with disharmony in relationships. For people on the ground, it's an integrated thing, but we have artificially separated these two contexts, and our funding is directed through different channels, and we tend to work in silos. We have developed different languages around the same issues, and we duplicating services and not being of the best service to people who are on the receiving end of this. So we recognize the strength of the community voice in co-creating a way forward and working through their leadership, and that on the ground, yes, they would talk about that there's conflict or that there are health issues or that there are livelihood issues, another angle through which this work can be done. Ultimately, we're working towards more peace of mind, believing that that will strengthen the social fabric that we are talking about. And that is the ultimate goal for these two disciplines as well, but knowing that the other entry points, like for instance, livelihood is a very important one. I was also just reflecting on what you were saying about this isn't the time for peace building. So I'm not a specialist in the Ukraine setting, but the one thing that I am aware of is that there have been ethical, diverse historical issues and language issues, and so especially in relation to the Russian populations, which is exacerbated under this war situation, that there can be land and property disputes. There are other social dynamics which are affected by the mental health issues, and that people have different interpretations of how they should deal with the perpetrators of crime in the war setting, the pace and the nature of reconciliation. There are many different issues that Ukrainians amongst themselves are also experiencing that is affecting relationships and social cohesion. And the other thing that I'm excited about is the early stage at which the intervention or that people are talking about doing this work in Ukraine. So we used to talk about applying this in a post-conflict situation, believing that the sustainability of the work would be greater in a post-conflict situation. But we've realized through the pilot studies that it can be at any stage, and actually prevention is better than cure. So to come in as early as possible, to work towards trusting relationships around communication, coordination, bringing in the different stakeholders in a safe space where people can have critical dialogue with each other and can generate themselves, according to their context, what is happening at that point in time on how to take the work forward. And I'll just end with a small example. This week, someone from northern Uganda contacted me. He also went through these workshops, and I asked him, so what is the most recent example you can tell me of how you think that your work, he's a local peace builder, on integration has happened for you now? And he said, well, an example is that we had different ethnic groups really becoming very violent with each other. There's a lot of aggression. They were fighting around sharing a football field. It really was very unpleasant. The relationships got torn apart even more. And because he had learned the MHPSS approach to this and the integrated approach, managed to bring in dialogue the different groups. They now share the football space. They play together. They've built new relationships. And he said, and we're talking about issues like suicide, which is really an epidemic in that society. And they are starting to talk about sensitive issues. And I'll leave it at that. So depending on the context, who's involved, what the issues are, how those issues manifest themselves, that's how one would know how to take it.
Thank you so much, Yvonne, for this introduction. And indeed, those examples are so worthwhile to share amongst us and to see, indeed, as you say, in different settings, there's different approaches needed. So thank you so much. And also for referring to your co-authors, Marianne and Friederike. Welcome to you as well. And I would like to now move to our third panelist, Ms. Marharyta Chaika from Ukraine. She has a degree in psychology and speech therapy, and she's also a specialist in alternative and augmentative communication. She will tell about it more, I'm sure, and also a specialist in early childhood intervention. She teaches at the Boris Budosan Kiev University for student psychology and speech therapy. And during the war, she continues to provide psychosocial support to internally displaced persons and continues to lead art therapy groups. Welcome to you, Marharyta, and I would like to invite you to also share a little bit about yourself with the participants.
Я рада усіх вітати. I'm very happy to see you here. Great introduction, thank you. Let me add besides being a speech therapist and psychologist, my professional activity in the war has changed. I originally was born and lived at the Donetsk region. Now I am an internally displaced person and I live in the Odessa region. And I work with people who are in the need of mental health and psychological support. So at the beginning of the war, I worked as augmentative communication specialist, and we worked producing literature for children who have delayed in development, in communicational development. So this my activity has to be postponed because of the military action, and I had to move. And so currently, well, first we moved and we supported provided psychological support to families with children from 0 to 4 with early intervention efforts. We came to understand that there are many children with psychological and psycho-emotional trauma, and they need a lot of effort. So we started with these families. We started to work with these families first, and we have a small team. Yeah, I'm very proud of my guys. We do a lot, and so we decided to move forward. And besides me teaching the students, as you have mentioned, we also work outside of Odessa region. We spread our experience to other regions to be able to reach other internally displaced people in other regions in Ukraine, because they're plentiful, and there are a lot of people who were traumatized from staying in occupied territories or in the military action areas. And also additional trauma is from moving, changing place of living, and adaptation to new environments. So I try to support my specialists and also work with families, with teenagers and families who are struggling, and also train specialists in how to work with these children and these families. So this is my work. Thank you very much for letting me introduce myself.
Thank you so much, Marharyta, for describing your work, and amazing what you are able to do. And I wanted to mention still the title of your publication, Working as a Therapist While Suffering War in Ukraine. That's your publication and intervention. And the one that Yvonne, Marianne, and Friederike worked on is a co-creation as a methodology to integrate MHPSS and peace building. So those are the articles of our panelists. Thank you so much for your introductions. I would like to move on now to some questions we have for you, our esteemed panel. And this question is as follows. Looking at the current situation in Ukraine and surrounding region, do you think it is right to build the foundations for mental health and psychosocial support and social reconstruction at this moment? I would like to hear our panelists and would like to start with Marharyta, coming from Ukraine. Marharyta, would you like to share some thoughts on this?
Дякую. Ну, я вважаю, що це питання є надзвичайно важливим.
Thank you. I think this is a very important issue. I think it is the time. It's a proper time. So many people in Ukraine had to leave, had to get out of the territory of Ukraine, and they're anticipating for the war to be over. And they're anticipating for the physical restoration and physical renovation of and restoration of peace but any beginning of any process requires for some preparation. So in issues as difficult as war and when it's going to be over, and how to overcome trauma and how to catch up with the lost development opportunities. This will definitely require for time and preparation, especially like internal emotional preparation. Without that, it will not be possible. So as I was contemplating the questions that we're discussing during our meeting, should we even try to think about social reconstruction, social like peace building, etc. I thought about the fact that Ukrainians only at the stage currently are only at the stage of trying to stop the trauma, regroup, and prepare for restoration processes. So this is very crucial for us to start these conversations and to provide proper support so that specialists in Ukraine, average people in Ukraine, and people who suffered from trauma will have time to rethink what will be necessary to for peace building, because this will take quite a lot of time, and also contemplation for what will take like what kind of systems will be necessary to build specialists, build capacities, build the systems. Maybe some systems of support provision will have to be rethought and restructured. And so I hope that this is something that we will be able to discuss today. And also my hope is that as we hear that this conflict is over, we will be able to come into the next phase prepared. Thank you very much.
Thank you so much, Marharyta, for sharing these reflections, which are actually also quite hopeful amidst everything. So thank you very much. And Yvonne, you already mentioned a bit about Ukraine. Would you like to add some reflections from your experience and insights?
Yeah, one of the reflections I had about it, and this is bringing in, there's such a big stigma around MHPSS and the use of the mental health services in general. But in this particular context, the very strength of Ukraine's identity around being strong and resilient and independent may also be a barrier on why people seek help for MHPSS, because vulnerability isn't embraced, especially by the large number of men that are conducting the war, who all have to show strength and kind of a part of a warrior culture. And these are issues that can exacerbate the barriers to seeking mental health care. And I think awareness around this can start at an early stage already, so that one can recognize what the symptoms are, what it looks like, why it would make problems worse if people didn't get the help that they wanted. And I'm aware of the creativity that has already been applied in Ukraine on how community mental health teams are working. They're doing the work. They've gone the work more online because it's not safe to travel. People have brought a whole different paradigm to understanding where it comes from, how it gets explained to others. Oh, we've got some interference happening. But yes, there's a lot of things are happening on the ground that can be made more visible to outsiders. And I think that the time to come in to do this, it cannot be early enough, because this is going to be generational work. There's going to be short-term and long-term goals, but the earlier we start, the better.
Thank you very much, Yvonne, for your reflections. I would like to now move to Boris, please. And Boris, this question, how would you compare this with the social cohesion among Ukrainian refugees? Would you like to share some thoughts on that?
Yeah, well, okay, I can say something, but I see among participants there is also Oksana Forostyak. She's from Ukraine and she's refugee herself in Czechia, and she's also one of the implementers of mental health psychosocial support program. So from my side, it's more about social cohesion between Ukrainian refugees and host community, not just in Czech Republic, but in all these refugee receiving countries. Because as usual in refugee crisis, this honeymoon period is kind of over, you know, and now, how to say, countries, you know, are, yeah, well, not so easy, you know, to accept more refugees and to integrate them, but still those who are there, you know, they will most probably try to integrate as much as possible. So I know, so I don't know, maybe Oksana can say a word or two on that if she's here. Oksana? If not, I see her here, but I mean, maybe she cannot. She's not. Yeah, she's here. I have some troubles with connection. Yeah, okay, maybe later, Oksana, no problem. So yeah, I think yeah, this is, I mean, for refugee receiving countries, it is the right time for how to say, integration and strengthening social cohesion, because otherwise we have problems. You know, we have hostilities, we have lack of tolerance between host community and refugees. So definitely that's the right time. And the focus of all these refugee receiving countries in the next year will be exactly on strengthening social cohesion and integration of Ukrainian refugees. And in case of Czechia, definitely more than 50%, maybe 60, 70 want to stay in the Czech Republic.
Okay. Thank you very much, Boris. I just heard that Yvonne would like to add one more thing to this question, and then we will move to the Q&A session of this element. Please, Yvonne.
I was just thinking of all the stakeholders that are currently already existing within the setting, and all the outsider influences that are coming through support, political and economic and other ways of coming into the country, and how important it is that these stakeholders collaborate with each other and coordinate their services. And this is also why it has to come together, because we can actually do harm in the way that we are doing it now. So that coordination is a really fine art to achieve, and it has to be made official and visible. Those structures have to be set up somehow.
Yes, thank you for this important addition, Yvonne, very much indeed. So before we move on, I would like to ask Megan, are there any questions from the audience?
There are no open questions. Oh, I was just going to say, I have no questions in the Q&A, and just a reminder, you are welcome to either raise your hand to speak, or if you'd like to use the Q&A function at the bottom, I will be monitoring the Q&A box. So feel free either way. Please go ahead.
Well,
yes, yes.
Well, I'm sorry to interrupt you guys, but thank you very much for the expose, which is really good. I wanted to maybe, yes, I've listened to all the interventions and also to Martin experiences in Ukraine, which really seem very nice. I really appreciate. However, I think now we need a lot to work in terms of coordination mechanism. I mean, like MHPSS technical working group, or bring it all the actors together, so we know who is doing what. where, to whom, all the 6 Ws or 5 Ws. If we can be able to put that coordination in place, then it would be helping us to know at what level have we intervened, at what level people are receiving the psychosocial support intervention in all the areas. And even for the hosted community, they also have the same different therapeutic group. They can also get involved, not only for IDPs or for refugees, but also all together, as we are doing here in DRC. It is almost the same experience we have here in DRC, whereby we work together with the community and IDPs. We bring them together, we share experiences, we have the therapeutic group all together, and now we share the experiences at the coordination level, MHPSS Technical Working Group coordination. So it helps us really to coordinate all the activities and efforts together in the country. This is only my contribution I wanted to add. Thank you very much.
Yes, thank you very much, Jonas. It's very much in line with Yvonne's comments, the importance of coordination and working together, very much. So if there are no other questions or comments at this very moment, we will move on to the next part. But
I see that, sorry, that Boris had his hand up. I don't know if he wanted to reply.
Ah, yes, sorry. Thank you, Megan. And Boris, please go ahead.
That's a good point, because I mean, that's actually a very strong point in all the refugee receiving countries. And every 2 weeks we have meetings of representatives of technical working groups from different countries, and we even evaluated ours in Czechia. And the participants, we have about 70 participants from 27 different organizations. They evaluated this very useful. And of course, in Ukraine, I mean, there is technical working group. I mean, not just one, right? There are also more than one, I think, on a national level and maybe regional levels. So yeah, I mean, that's a very good point from Jonas, right? A very good point. I just wanted to reply to that.
Yes, very much. Thank you, Boris. Yes, indeed. And I heard that the technical working group in Ukraine is one of the biggest in any country. There's really a lot of organizations involved there, I understood. So now we would like to move on to the next question to our panelists, which is, which stakeholders and organizations from both the social reconstruction field and the mental health and psychosocial support field need to be involved, and how do we best facilitate that collaboration to arrive at joint outcomes? So, Marharyta, would you like to reflect on this question?
Дякую. Зрозуміла, дякую. По-перше, звісно, я вбачаю великі...
First of all, I see the sense in providing psychological and mental health support on all levels. There were questions on related to how it's organized in Ukraine currently. Probably I will answer this question later, but I believe it's very important to provide this mental health and psychological support among families, among children, among those who are internally displaced. So that the nation will be able to move forward in the restoration. So we need specialists who will be able to who will be capable to work in this area. So we need psychologists, social workers, and social support workers may not cope. They will be ideal, but they may not necessarily be enough. So, but they work with a wider audience, like so I believe without including them, it will not be possible. We need to provide particular training for social workers who can participate on all levels in society. And also we need to engage such resources that are active on a national level, who will be policymakers and an organizational effort behind the support. So possibly this is also involvement of NGOs and businesses that will be providing support to launch this work. I think a lot of businesses right now stopped because people find their identity. They need jobs, and so in some regions of Ukraine this is still a miss. But I believe that we need to start from mental health and psychological support on all of the levels in order to stabilize the situation. And so this is also not possible without advocating an advocacy effort from NGOs. So thank you.
Thank you so much, Marharyta, for sharing these reflections. I will first move to the other panelists. I see some hands raised, so we will keep the questions for after hearing Yvonne and Boris. Yvonne, may I invite you to share some reflections?
Thank you. I think it's a really important question. We're talking about a broader, holistic approach here, and who to invite and who to know to invite to be part of this dialogue and to take the word forward. 3 work has to be done before you start a formal process, like a proper mapping of who are all the stakeholders, what are they doing, what are they bringing, what is their focus on, what are the other resources that are available. These stakeholders have to come from both fields, but we need to involve a strong community voice as well, formal and informal leaders. And so, yes, from the people that have decision-making power that are in the room, as well as that can really speak strongly around the contextual situation, and everybody that is trying to work towards social cohesion in some form or other, who has that as an important agenda. I know you're running out of time, so I'll keep it short, but I do think that the emphasis is that you can do quite a lot of work with careful mapping beforehand, and then bringing the actors together, and it will vary again from one space to another, one geographical spot to another.
Thank you so much, Yvonne. Yeah, I think it's so crucial to really know for sure who are all the actors and what do they bring indeed, as you were saying. So thank you very much. I would like to move to Boris now. Boris, would you like to reflect a bit on social cohesion and what it means in a refugee context?
Well, yes, I mean, I already mentioned that, in a refugee context, it's all between refugees and host population, because we have to be very careful with our programs and not to, somehow neglect the host population. Otherwise, you get the complaints, and refugees are getting better services than us, blah, blah, this kind of thing, So social cohesion is that actually, in this context, that you pay same attention to refugees and to the host populations. So if refugees get something, for example, our community mental health centers, they should serve both refugees and host population. So this is strengthening the whole community mental health system in Czechia for the host population also, not just for the refugees. But this refugee crisis we consider as an opportunity to do so, to strengthen the community mental health system in general, which will actually stay for the host population and for the refugees who will be integrated in. in Czechia. And just I see Jonas is still here. You know that this 5WH tracker we already have for from the last year. That's probably the first thing we established. You know, who is doing what, where, when, and to whom. And but the problem is with updating. Like in every emergency I've been so far, you know, it worked for some time and then just people stop updating it. But still, through the coordination, through our technical working group meetings, we are able to find out who is doing what. Thank you.
Yes, thank you so much, Boris, for these reflections. Yes, I think we all recognize those challenges as well. Yeah, thank you. I would like to move now to Megan to see if there's any questions from the participating group to be addressed.
Yes, we do have a couple. So there's one in the Q&A and from an anonymous attendee. Are there lessons from past conflicts such as Northern Ireland, Liberia, Sierra Leone in terms of social reconstruction and other areas of former conflict? I don't know if anyone of the panelists would like to take that one on. Maybe Yvonne can speak to a couple of the other contexts that you've worked in.
I do think that that there are lessons we can learn from other contexts. But we can't draw any general recipe from these. If I take South Africa as an example, for us, we didn't visibly to the outside world actually have a war, but everything that happened around depression and apartheid had enormous consequences on our social reconstruction. And we had systems in place like the Truth and Reconciliation process that is held up as an example in many places in the world, but we are still seeing that the truth part got managed very well. The reconciliation part was less successful and is causing ongoing difficulty. So it's good to look at mechanisms that other places have used. I think that a place like Ukraine, what we're seeing happening at the moment in terms of Gaza and Israel, there's such vastly different contexts that one has to take those internal dynamics in consideration, but certainly one can draw from examples from other fields too. I don't know, Marianne or Boris or someone else that wants to add particular examples.
Can I say something, Megan?
I think so, unless my timekeeper is forcing me to move on, forcing us to move on. Maybe just a brief addition.
Well, I think it's very important to recognize that we take everybody with us. And now in Ukraine, where so many international organizations are coming with all the good intentions, you really run a risk that that we forget to take the local people with us, and it's their lives and their environment and their reconstruction. And I think this is very important, to be with them all the time.
Thank you, Marianne. And just to quickly point to one final comment in the chat before we move on, Renette said, is there anyone with MHPSS experience with working with the Peace and Development Advisors of the UNDP-DPPA Joint Program for Building and Sustaining Peace? Renette, did you want to say a few words about that? I'm not sure if she's been made a panelist or not.
Sorry, are you asking me?
No, Renette. Yes.
I was just made a panelist, and so I for a moment was out of the meeting and then back in, so I didn't hear the second part of what you just said, Megan, but my question is really, it's not Ukraine specific, but trying to get those that work on conflict prevention, on social reconstruction, on building and sustaining peace, and those that work on MHPSS and often, but not only, but mainly from a humanitarian viewpoint, they often don't speak to each other so much, and our institutions, those different institutions involved, also do not interact always. So I've always been interested whether MHPSS technical working groups have in some cases also been attended by peace and development advisors that are seconded by the UNDP DPPA joint program. It has a very beautiful title, but it's a joint program on building and sustaining peace. But maybe it goes beyond this webinar on Ukraine.
I think it's nice just to shortly highlight that there are different tools between these two different communities of people who are working. Jonas mentioned also the technical working group and the 5 Ws, which are very much MHPSS mechanisms. And you've mentioned now some peace building mechanisms. So indeed, part of having people work together is also raising awareness of some of these shared tools and platforms. And I see some other hands up, but I believe we need to move on to the next question. So I wonder if it's okay if we table, Jonas and Frederica, if we table the other insights until the end. I think there will be more space to continue the discussion.
Yeah, thank you, Megan. Thank you, everyone. I think this is a good bridge to wrap up the first, well, so to speak, official part of this webinar. As usual, so much to discuss and more time would be very welcome. Luckily, we have some more time for those who are able to stay. So we just wanted to thank everyone for their participation. If you have to go now, thank you very much for being with us. Just wanted to mention you can sign up for the newsletter of intervention, which will be shared in the chat. And if you can and want, you're very welcome to stay in the after talk. We still have half an hour. Just visualize a cup of coffee with that, and we can talk further together on this very interesting topic. So thank you. And I think now, then Megan, I can move back to you because we can then continue with the questions for those who can stay with us. Thank you.
I don't have any additional questions in the chat, but I see that Jonas has had his hand up for a while, and Frederica also had her hand up previously. So
yeah,
Jonas and then Frederica.
I had something to contribute, if possible.
Mm-hmm.
Well, the other issue I wanted maybe to bring on table is about availability of fundings. You know, of course, you know, MHPSS activities, to some extent, they are somehow ignored, but they don't have really budget on. And then if it really could be a budget, like a permanent budget, which could help all this mechanism, strengthen the mechanism of MHPSS working group, and also providing also livelihood for all the beneficiaries. It also strengthen it strengthen the cohesion between IDPs, between refugees, of course, and hosted community. So this is also another point that we should also table out whenever we are raising funds to donors and wherever it can be possible. It is something very important, and this can help. So if I can link it to our experience here in Africa, whereby we have tried to turn around, like in Chad, in the DRC, in Sierra Leone as well, we have been lacking these fundings, and then consequently, we do not respond because we respond accordingly to what we are supposed to. Two is that whenever we get our fundings, we get it for a short-term project. It's like 3 months, which is not really helping us to progress and to go further. Last and least is when attending the coordination mechanism, sometimes organizations do not maintain a staff. They keep changing because of this funding's availability. So whenever a staff is permanent, and focusing on this coordination mechanism, the contribution is important. Thank you very much. Otherwise.
Thank you, Jonas. That's really reflecting on some important structural issues there that certainly shape how collaboration can take place on these two issues. That's great. Thank you. Frederica, you had your hand up before. I don't know if you wanted to add something.
Thanks, Megan, and thanks everyone for this lovely webinar. And it's wonderful to see so many kindred spirits. I also just wanted to take a moment to acknowledge and honor those, especially people like Marharyta, I hope I pronounced that correctly, for doing such remarkable work in such difficult times. That includes you, of course, Boris. So much appreciation for your contribution to this world we're currently living in. A few short points. One, Megan, your comment about the tools, the mapping tools in particular, TWG and 5Ws. I'll never forget being in a co-creation workshop in Zimbabwe a few years back with Marion and Yvonne, and sort of reaching this aha moment, which we were desperately waiting for, with peace builders on the one hand and MHPSS practitioners on the other, sort of really pulling at straws to find a way in which we could work together. And what we realized was that we had these tools in common, not the nitty-gritty of them, but certainly, peace builders could conduct a conflict analysis or a peace and conflict analysis. We do a stakeholder mapping. We look at the root causes. We see who's on the ground, and that does to some extent overlap with the work that MHPSS professionals do. And so the aha moment was really this realization that if we brought those tools together with the lens on co-creation, we could have a much more holistic view on the conflict, and then sort of embark on our respective journeys of whether you call it peace building or reconstruction. So I think there's a lot of opportunity there in joint assessments of the situations we're working in. I just wanted to also touch on this notion of are there experiences from other countries that somebody put into the chat. Yvonne already touched on the South African Truth and Reconciliation Commission. What I find really interesting is this work that most of us who are on this call and I think others who are on the webinar have been doing in integrating MHPSS and peace building has been happening with quite a lot of momentum. It's also been happening sort of parallel to the emergence of the humanitarian development peace nexus. And I think both are emerging as a result of the realization that we know that we can no longer work in silos. And so if we look at, for instance, South Africa in the late 90s with our Truth Commission, or indeed Sierra Leone, Northern Ireland, Uganda, many of these countries that had so-called transitional justice processes, we realize now, looking back on those contexts, that they weren't in themselves sufficient, that we needed much more integrated efforts. And so, for instance, in South Africa, we're realizing that the economic justice component was missing from the truth and reconciliation process. And so I guess that's a roundabout way of saying that we've come a very long way in realizing that we need each other. Humanitarian development, peace, livelihoods, not just MHPSS and peace building. And every context does need its own processes. Some countries will need a truth commission, a reconciliation process. Others will need more of a focus on physical reconstruction, on the provision of mental health service, and so forth. And then very briefly to Renette, I've worked with UNDP peace and development advisors and found that many of them don't yet have MHPSS expertise. Absolute appetite, often as a result of being based in countries where they can see that the need is there for MHPSS integration, but no technical knowledge themselves. And I think there's a real opportunity to ensure that we develop curricula for peace and development advisors to ensure that they have both of those lenses. Okay, thank you. Over.
Thank you so much for all of those really wonderful points. I believe we can take more questions. Yes, Relinde, we're still going because I see one in the Q&A. Does it make sense to read them several at a time and then see if the panelists want to take them on?
Yes, that sounds as a good idea. Yeah.
Okay.
Thank you.
So there's one in the Q&A. In conflict settings, what do you say to people who are so consumed with hatred and anger, focused on their enemy when it's affecting their own mental health? That's a big one. And then there are two in the webinar chat that I will flag. Ajaz says, as I've worked in Mariupol for 2021, covering Zaporizhzhia as ICRC MHPSS delegate, I would like to know about the current status of coordination with the Ministry of Social Welfare and Ministry of Health from international organizations in terms of MHPSS. That might be one that Marharyta can take, or perhaps somebody else in the audience. And Nisa says, hi, is there a specific mechanism for M&E on the intersection between MHPSS and peace building? Do any of the panelists want to respond to any of those three questions?
Okay.
Yeah.
Maybe for the first one, because I have first-hand experience with, violence, anger, hatred from former Yugoslavia. And sometimes
Да, думаю, що можу. Сьогодні
and sometimes you can say nothing, because with some people you cannot really go into any if they are consumed with anger and hatred so much. You can try to somehow neutralize that anger and hatred, but sometimes it's very tricky because you may even die because of that, because they may misunderstand you. So from my experience, and I've been here throughout all the war, working with all the ethnic groups, and yeah, you can usually work with people who do not have such high level of hatred and anger. With them, you can work, you can do something. But with the others, you have to be very careful, and not sure. You have to pick up the right moment to discuss any sensitive issue with them. Otherwise, I don't know. It may even cost you life, to be honest with you.
Great, thank you, Boris. Marharyta, do you want to go next? Do you want to respond?
Так.
Yes, thank you.
По-перше, тут було запитання щодо саме психологічної такої підтримки і взаємодії між собою різних
Well, there was a question between the MHPSS specialists and partnership with different governmental organizations. Yes, there is a partnership between these organizations. War lasts for over 600 days. So it was enough time for building partnership between governmental organizations and NGOs and MHPSS specialists. Right now, there's a pan-Ukrainian project on psychosocial social support. Many towns and cities of Ukraine have opened MHPSS centers that operate in local hospitals, and they involved coordinators of local communities, and they work to support people with psychological and who are in need of psychological and psychosocial support. So we have specialists from psychology and also from social workers who are able to provide care. However, the visibility is crucial here, because the local population needs to know how to track the markers that identify the issue. that points to the need of help. So what we see, many people currently ignore their symptoms or are not aware of those symptoms. And so currently there's a wide informational program. We print a lot of information, disseminate a lot of information in the cities, and disseminate it in hospitals for adults, for children. There's a social ads on radio and TV. And so this program is used to raise awareness of the society, and also to coordinate work of different agencies. I will not be able to say that this is a well-coordinated work at this point, because all of the involved agencies will have to be coordinating efficiently, which is not the case in Ukrainian realities. So and however, there's coordination that is effective, although there's no political legal mechanism. And so we're pushing for developing practical mechanisms of coordination even before it is legally affirmed as an official policy of coordination. So we see some positive results in that area, and we hope for better coordination in the future as well. Thank you.
Thanks, Marharyta. Yvonne, anything to add?
I'll try and just talk a little bit about the last question about M&E. And I think people have seen in the chat box that there are groups and resources currently working on this, and just wanting to acknowledge that everybody that has joined this particular webinar has a lot of experience and would be able to add to this topic. But again, it's something that is co-created within the context, depending on what the outcome is that you want to achieve. So, I mean, even asking a question like, how would you know that there's stronger social cohesion in your society? People would come up with such interesting answers, and their reflections can be turned into indicators of change. But also to mention that it really depends on what people want to achieve on a short-term level and what they want to achieve on a long-term level, and what shape or form their integration work wants to look like. Integration is not just one form. It doesn't have to be full integration of everybody and everything and all sectors all the time. People will decide how they want that integration to look like. And if we look at one of the important elements that we spoke about during this process today, for instance, the coordination mechanisms. If you know that the outcome of the work is going to be dependent on how well those coordination mechanisms are, how are you going to build in that as an indicator? How do you build in your activities around achieving that indicator in that sense? So any of the elements that come up, any of the issues that you are wanting to see, how to tailor it alongside that. Yeah, thank you.
Thank you for adding those reflections, Yvonne. Absolutely. I see that there's one hand raised. Njoya, would you like to unmute and ask your question? I think maybe now you've muted yourself. Sorry. Joy, are you a panelist? Are you able to?
Good afternoon to all the
Yes.
panelists. I don't know if you are hearing me now.
Yes, we hear you.
Oh, thank you very much. I'm sorry I joined the team late because I've been battling with network issues. I am Joya Kelvin Ngala. I'm joining you guys from Cameroon. I'm so pleased to follow up the webinar today. I am the CEO of Kellen Association. Kellen is Keeping Empathy and Livelihood Empowerment Network, which we are working with children with disabilities and their parents who are suffering who are passing through one form of stress or mental health condition which nobody is there to attend to them. You can imagine a parent who is carrying on with her pregnancy, and at the end of the day, she's giving birth to a child with a disability. We can imagine how stressful she can be. Those are the kind of people we are intervening in. And in my own region in question, which is in the Northwest, we have been faced with a crisis, an armed conflict that has been running through for close to 7 years now. Many people have been displaced, and some could not be displaced because of lack of means of transportation or finances. And some of whom could not be displaced are persons with disability. So we and some of our community-based rehabilitation workers who will go to the community, struggle to talk to these people and see what can be done at their own level. We have been struggling with that for the past 3 years now. Like Mr. Jonas said, it's not easy, because if you are an association or an organization which you don't have funding and you are relying on a contribution from members, you cannot really attain to the needed population. The population is high, but there is no fund to attend to them. So when I see webinars on mental health and psychosocial support, I always like to attend as a clinical counselor to upgrade my capacity on how to attend to this vulnerable population. I must comment that if there is any way to assist me in building my capacity, you guys should not hesitate to invite our association for these meetings. We will learn much from this, because after this meeting, I will have to organize another meeting with my team and have a restitution meeting on what has been going on, or on what I have learned from you guys today. Thank you very much.
Thank you so much for sharing your experience, and it's an honor to have you with us today. Thank you so much. Marianne, would you like to share something?
Yes, I would like to go back to the first part and the comment of Jonas, who said of the 5W and coordination and mapping tools, which I think is extremely important. But working together through the silos and cross-cutting needs, I think, more, and needs especially more that we do understand each other, that people who are working in the reconstruction or peace building really do understand what MHPSS means, and the other way around. Our experience is that people have all kind of implicit ideas which are not reflecting the reality, and which makes it difficult for people to work together. So sitting together, understanding, telling each other what you really do and what your intention is, and seeking where you can support each other and make each other stronger is an essential part of going further and working together. I think only then we are able to have a joint relationship where you can discuss and make plan. This is what you are going to do. This is what I'm going to do. This is when I come in, and when you can ask me, any other way around, I think. Thank you.
Absolutely. Yeah. Thank you for sharing a bit more about how you see that. I think if there's anything that can be taken away from this conversation, it's that creating those platforms for exchange and for the sharing of joint approaches is really important for everybody to be on the same page and know what the other is talking about in order to work together. I think we have just a few minutes left. I don't see any hands or maybe 2 new messages in the chat. No, I don't see any other questions. Are there any last questions before we conclude? I'm not seeing anything else in the Q&A or the chat.
There's
Okay,
one question about Ukrainian refugees accessing MHPSS in Scotland. I don't know if that is a...
Curious now to look into how where Ukrainian refugees have access MHPSS in Scotland. Well, I think that it might be outside of the scope of this particular webinar, but I mean, I imagine that some of the structures would be similar to the places where Ukrainian refugees are seeking place in Czechia. So maybe Boris could comment shortly on some of the structures and the typical places, and that could guide also where you would look in another context like Scotland.
Yeah, well, I don't think that the context of Czechia is so far from context of Scotland regarding Ukrainian refugees. I mean, Czechia is also a high-income country.
Yeah.
Well-developed health system, and the basic thing is mandatory health insurance. You know, in Czechia and Ukrainian refugees have a mandatory health insurance, so that's how they access. But the problem is overwhelmed health system because there are many of them. So sometimes waiting lists are long, but so are probably in Scotland for Scottish people. You know, this is like now a problem almost everywhere, you know. So I don't know. I mean, access for people from rural areas is maybe more difficult, but that's where we step in, you know. And then to the WHO supported projects and from other organizations, we cover transportation costs, for example, you know. And we also have how to say, in our multidisciplinary community mental health teams, we also have a range of professionals from psychiatry, psychology, speech therapist, nurse. So they're all, that's how they go to the community. So it's both outreach and then, of course, outpatient service when they come to. So that's how they, in general, how they get the access in Czechia. Health services, MHPSS included. Yeah.
Perfect. Thank you, Boris, for sharing. Hopefully that is helpful to the PhD student who asked the question. Are there any final questions?
Or any final reflections from Marharyta or Yvonne?
It's just been really interesting to hear everybody's contribution to this, and this, you know, putting all these voices together, weaving together the important aspects people are bringing up as like a co-creation of finding a way forward as well. And it will only be in this dialogue that we will be able to find a way that could work in Ukraine. And I found it particularly interesting that we thought about the term social reconstruction as opposed to peace building, how that just opened other spaces in my mind around how to approach the topic. So I think it had a very fresh angle to it, and I just wanted to thank everybody.
Thank you so much, Yvonne. And Marharyta, some final thoughts from your side for this webinar?
Так, звісно, я щиро рада приймати участь
Yes,
в...
thank you very much. I am excited to participate in an event like this. A lot of important and interesting information, good for building future strategies for social reconstruction and peace building efforts, actually. So thank you very much for the questions that you have raised. I'm very thankful for your participation.
Thank you so much to everyone, to Marharyta, Yvonne, and Boris for being on our panel. Much appreciated. And for all the participants for being with us. This was truly inspiring, and we will make sure to follow up with an email with the recording of this session and some additional information. And we would very much appreciate to remain connected and continue building this integration of MHPSS and peace building together. Thank you so much, and wish you a very good day.
Thank you.
Thank you, everyone.
Bye.
Bye-bye. So, just us left.
I think there are still a few people who weren't panelists.
Ah, yeah.
A few attendees who are still there. But indeed, they're not visible, so you don't think that they're there. Yeah, thank you to all the panelists. That was really a wonderful discussion.
Yes, thanks so much. Yeah, I really enjoyed that, and I think it provides really great grounds to some seeds again to work on together from here. So yeah, it was really really inspiring.
It is. I see Irina is also
Hey, Rina.
here.
Hi, everybody.
Hey.
Great job. Great job. It
Hi.
was so interesting. Really well done, everybody. Thank you.
And great that you were here.
Yeah, I heard it all.
Wonderful.
Good. Nice. Where are you joining us from?
I'm very close to Yvonne, probably. I'm in Kokstad. In near yeah. Where are you located, Yvonne?
Right. In Kleinmond, near Manus.
Ah, yes.
Yeah, thanks so much everyone for your contributions and navigating this webinar, Relinde. Great job.
So there were more
Welcome.
than 80 participants.
Yeah, wonderful, isn't it? So it resonates with people, really.
And I was checking after the first hour because not a lot of them left. I mean, some people left, but not. We still had quite a few after that hour until the end, which was nice.
Yeah, people usually enjoy that last those last 30 minutes.
Yeah.
And nice that we had Jeanette there asking her question. So it's good to follow up quickly now, of course, with the briefs and everything. It's on the radar.
Exactly. It sets the stage.
Yeah.
Definitely.
Yeah. And thanks so much, Marharyta, for being here. Great job.
Thank you so much.
And Maxime, thank you so much. It wouldn't have been possible without you. Ah.
Hey.
My pleasure, guys.
Yeah.
Thanks a lot, Maxime
Cheers.
and Marharyta and Yvonne. Much
All right. Well, we have recorded everything. I made some screenshots.
Wonderful.
So maybe we'll share some things online, and I'm trying to save the chat. Just for things.
Yeah, there was some interesting exchange also in the chat too.
Yeah.
So
yeah. Well, thanks a lot, and enjoy the rest of your day.
Yeah,
Thank you.
Same to you.
Bye-bye, everybody.
Thanks a lot. Speak soon.
Everybody.
Yes.
Bye.